First aid syncope. The medical term for fainting is syncope. A faint is a brief loss of consciousness, generally of no more than few minutes duration, caused by a temporary reduction in the blood flow to the brain. Recovery is usually rapid and complete. The main causes are emotional shock, pain, lack of food, overexertion, dehydration, exhaustion, sight of blood, standing up suddenly, standing in hot condition, heart rhythm change or heart condition, and illness or some medications. How to give first aid when fainting. If you see someone feeling faint, sit them on chair with their head bent forwards between knees.
Having a person sit with her head between her knees increases blood flow to the brain and may prevent a fainting episode.
If you see someone that already fainted,
check for responsiveness by gently shake the patient's body.
Lay the casualty with their legs up to help blood flow back towards the brain.
Check the airway. Is the airway clear? If not, open their airway by tilting their head and lifting their chin.
Check for breathing rate and pulse.
Patient's breathing rate is 16 per minute. It is normal. For pulse rate, we found that the patient's pulse rate is 70 beats per minute. It is also normal.
Loosen any tight clothing at the neck, chest, and waist.
This action will increase blood flow to the brain.
Make sure the patient has plenty of fresh air. Bring the victim to consciousness. There are two ways. First is to moisten a handkerchief or improvised material in the form of rag in cold water and apply to forehead to narrow the vessels. And the second way, bring cotton wool, moisten with liquid ammonia to a nose.
As the patient is breathing but unconscious, move the patient into recovery position. This will keep their airway clear and open.
When recovered, sit casualty up first before allowing her to stand up. You can give her warm tea. The explanation was that caffeine in the warm tea leads to a small and acute rise in blood pressure effect, which counteracts the small decreases in arterial pressure seen in syncope patients. If recovery doesn't take place within a minute or so, it is probably more serious than a faint. In this case, open airway, check breathing, pulse, and be prepared to resuscitate. If they still do not recover after a further minutes, call 112 or local emergency number. Thank you.